So thank you all for joining us for our second program of our 16th anniversary Hurricane Katrina week. My name is Gaynell Brady. I'm the Executive Director at the Lower Ninth Ward Homeownership. I am joined tonight by my wonderful co-worker, Sarah Bruzzi, who is behind the scenes controlling everything that you see here. And then I have our special guest speaker tonight, Ms. Sherridell Lewis from Metropolitan Human Services District, who will be presenting tonight. So Ms. Sherridell, I'm going to turn everything over to you. You can just tell us a little bit about yourself and begin your presentation.
Okay, good evening, everybody. My name, as Gaynell has said, is Sherridell Lewis. I am one of 5 clinic managers with Metropolitan Human Services District. I manage the New Orleans East Behavioral Health Clinic, which is located at 5630 Reed Boulevard, right across from Joe Brown Park, across from library. We are on the 2nd floor and the DePaul Community Health Clinic. I'm going to tell you a little bit about what we do here at Metropolitan Human Services. But first of all, I'd like to give you a little history of our agency. We were established in 2000. Or could you just go back to the first slide first? Thank you. We were established in 2003 when the legislature authorized the creation of Metropolitan Human Services District to oversee and be responsible for publicly funded, community-based mental health, addictive disorders, and developmental disability services for the population, for the vulnerable population. Our executive director is Dr. Rochelle Head Dunham. Second slide. Who we are. Metropolitan Human Services District mission is to provide or ensure that person-centered support and services are available, and person-centered services and support of services that focuses on the person and not the condition or the illness. And those individuals who are eligible for who have mental illness, who have addictive disorders, and who have intellectual and or developmental disabilities are in Orleans, Plaquemines, and St. Bernard parishes. We provide services to all age groups from 0, I want to say till death, but from 0 to the elderly population. Again, Orleans, Plaquemines, and St. Bernard parishes. We service the uninsured or Medicaid eligible individuals. We do not provide services for anyone who has private insurance or Medicare Advantage, but we do provide services for anyone who have regular Medicare. When we say people who are suffering with mental illness, we are talking about those individuals who experience severe depression, anxiety, PTSD, which is post-traumatic stress disorder, schizophrenia, or bipolar disorders. We also provide addiction services, and addiction services encompass people who are experiencing alcohol problems with alcohol, opiates, which could be heroin or painkillers, cocaine, as well as people who are experiencing problems with gambling. Individuals who have intellectual or physical impairment, that is our intellectual and developmental disabilities program. And those are people who have developmental or intellectual disabilities before the age of 22. But we provide services to all those different individuals. Next slide. How do you access our program? Well, we have what we call is our point of entry. And the point of entry is all someone has to do is call what is our care center. And that number is 568-3130. The care center will do a screening, they will triage, and then they will schedule an appointment with one of our social workers, master's level social worker, or one of our addiction counselors, or one of our psychiatrists, or one of our nurses. They will also receive referrals if they need any referrals through our resource coordination unit for any additional services. We take referrals from hospitals. We do aftercares from, it could be from university, it could be from private hospital. If someone has had a stay within one of those hospitals, they can call and schedule an aftercare appointment if that person meets our eligibility. We get referrals from primary care physicians. We get referrals from schools and also churches and other facilities and other sources. Again, we have 5 clinics that provide services within the Metropolitan Human Services area. And that area, again, is Orleans, Plaquemines, and St. Bernard. The slide says that we provide walk-in services, but due to COVID, we haven't been doing any walk-in services. We have been using the telehealth via telehealth, either audio or video. And we do assessments with the substance abuse, with the mental health, with intellectual disabilities as well. Next slide. Our clinic locations are Algiers Fisher, which is located at 3100 General de Gaulle. Our Central City Clinic, which is 2221 Phillip Street. And we always say the landmark is the Chicken Mart. We're right around that area, Jackson and Simon Bolivar, around the Chicken Mart. The New Orleans East Clinic, which is 5630 Reed Boulevard, and that's the clinic that I manage, which if anybody knows anything about before Katrina, that would have been the clinic that would have been right there, Desire, Florida, mental health clinic, which was located on Florida and Desire. Now it's called New Orleans East Behavioral Health Center. The Charters Pontchartrain Clinic, which is 719 Elysian Fields, which Ms. Gaynell and myself were talking about, used to service both adults and children, but now that is one of our main, that is our main children facility, the Charters Pontchartrain Clinic. And then we have our St. Bernard Clinic, which services St. Bernard Parish. It's located at 6624 St. Claude Avenue, which is in Araby. It's right across the track, right by the Rallies, which used to be the old Chase Bank. It's in that building. And then we have our Plaquemines Clinic, which is Plaquemine Community Care. And that's a contract that we have with them to provide services for the residents of Plaquemines Parish. And it's located at 115 Keaton Drive in Belle Chase. The clinic hours are basically from 8 to 4:30, Monday through Friday. We do have some after hours clinics for children. The Charters Pontchartrain has after hours services, as well as our St. Bernard Clinic have after hours services. Next slide.
Can I actually ask a question about that?
Sure.
If somebody in the lower 9th ward is wanting to use your services, would they be able to go to the St. Bernard Behavioral Health Center since it's right around the corner from us, or would they need to go to one in Orleans Parish?
No, they can go to any of our clinics. First point of entry is to call and get screened, and then let them know that this is where the clinic, everybody has a choice, and you can let them know that this is where I like to have my services. Initially, all our initial services, well, since we're doing telehealth, it could be anywhere, but our before telehealth, Central City would be where everybody went initially for their initial psychiatric evaluation. And from there, they were funneled to whatever clinic. It could be St. Bernard, since the lower 9th ward is closer to St. Bernard, or it could be to the New Orleans East Clinic. But you have a choice to go to whichever clinic that you would like to or feel comfortable with going to.
Okay, thank you.
Mm-hmm. Next slide. So some of the services that we do provide, we have a nursing team. Once you are registered, and you have your appointments and you meet with the social worker, then you will get a nursing assessment. The nurse provides the vital signs. If anybody who needs an injection, once they've seen a psychiatrist, and the psychiatrist put them on any kind of injectable medication, the nurse does the injections. We do initial nursing eval, and then you get an evaluation annually as long as you are part of our clinic. The nurse do IV testing, HIV testing, if with your permission, if that's something that you would like to have done. They do urine pregnancy tests, they do drug screenings. Now, our drug screenings is something that is mandatory. And we don't just test for illicit substances, we are testing to make sure that the medications that our prescribers have ordered is in your system and is at a level that is treatable, that would be effective for what they are treating you for. So that's the reason why we do our nurses do drug screenings. We also test for TB with our addiction services. We can do a breathalyzer test. We do hepatitis A testing. We also do education as it relates to Narcan. As another part of our addiction program, we have a medication assisted program, and they do the Vivitrol and the Suboxone. So the nurses are responsible for making sure that, again, the testing, the drug urine test will show that you are taking your medication. We have supportive services, smoking cessation. We distribute the condoms. We do education, we do teaching, we do training. We do phone triage if you're not certain about how to take your medication, or if you have any questions around your medications, then you can call and the nurse can give you some instructions over the phone as well. Next slide. Any questions? Our intellectual developmental disabilities program is for those people, again, who have had an intellectual or a developmental disability before the age of 22. And we provide psychological testing, we do respite care. If anybody needs nursing home assistance, they help with nursing home assistance. They do behavior support services for the individuals who are in that program, along with psychiatric care as well. The Medicaid waiver, that is where you get a cash subsidy, a monthly cash subsidy to help to help with the living expenses of someone who has a developmental disability. You have to apply. It's a waiting list. Of course, there's a long waiting list, but you can apply, and if eligible, you can receive a stipend of up to $258 on a monthly basis. Next slide. Our child and youth services. Again, the mission for the child and youth services is to serve and support youth who have emotional and behavioral impairments and their caregivers to keep families healthy. Their criteria is basically the same: parents, caregivers, the child, the adolescent who is needing behavioral health service, suffers with mental illness or addiction or intellectual disabilities, who range in the ages less than 21 years old. Once you turn 21, then you transition to our adult services clinic. And again, we treat the uninsured or the Medicaid eligible families who are in need of services. The number, again, in order to access those services is 568, area code 504-568-3130. And they provide assessments. They do the nursing assessments. They do the social work assessments. If addiction is an area of concern, then they will do what's called an addiction assessment as well. The clinics that provide the children's services, our main children's services clinic is our charter sponsor trained clinic on Elysian Fields, 719 Elysian Fields, but we do have other clinics within our, under our umbrella. The New Orleans East Clinic does children's services. Our LGS Clinic provides children's services. And our St. Bernard Clinic provides children's services in the afternoons. That's an evening clinic at the St. Bernard Clinic. Next slide. Again, this is information as it relates to the adult services, basically the psychosocial, the psychiatric. We do provide crisis intervention after hours if there's a crisis or a need for any kind of services after 4:30. We have what's called an MCART, the Mobile Crisis Unit Response Team, and they will go out, or you can call the crisis number, and they will either go out to the homes or they will direct you as far as what you need to do in order to receive or help you to deal with whatever crisis situation that may be going on. We have peer support services. That's someone who, a peer support is someone themselves who have either a mental illness or an addiction problem, who is in treatment, who's stable, and they have lived experiences. They can tell you what helped them in order to recover, and what are they doing at this point to stay in recovery. So those are called peer support. We do medication management along with the urine screenings. We do individual and group therapy, and that's both for our substance abuse individuals as well as our mental health individuals. And again, those same nursing assessments that they do, the HIV, TB, pregnancy tests, all those are done within all of our services, whether or not it's mental health, whether or not it's addiction, or whether or not it's intellectual disabilities. Those main screenings are done across the board for anyone who access services within our within Metropolitan Human Services. Next slide. Our addiction services, and our addiction services are geared toward those individuals with alcohol, drug, and gambling problems. And those persons, we do prevention. We assist with prevention services, outpatient services. For those individuals, we provide trauma-informed care. We try to tailor those services to the needs of the person who is accessing services with us. We provide case management. Again, we do assessments, we do referrals, we do medication management, group and individual therapy with our addiction population as well. Next slide. Basically, this is the same thing. It seems like it's the same thing that we've been talking about our different services. You access our addiction services again through the 568-3130. Remember that number. That's the number to access any service that you are interested in through Metropolitan. We do the addiction ASI. We do detox. If someone is interested in detox services, we can make a referral either to Odyssey House for detox. We make referrals to Bridge House, Grace House for addiction services. We have somebody on staff. If you family members or you may have a gambling problem, we have someone who can assist with gambling services, and that's a free service. You don't have to have insurance. You don't have to have Medicaid. That's a free service to anybody who is experiencing any kind of gambling, who needs any kind of gambling assistance. And it's, again, addiction services are for adults as well as children. Next slide. Metropolitan also provides an office-based, what's called office-based OpR treatment, and the acronym is OBOT. In 2020, we started our OBOT program, and that's where if you have an addiction, need addiction treatment, and you want to be on some sort of medication to assist you with staying in recovery, staying drug-free, then we will provide you with medication. It's either Vivitrol or it's Suboxone, or we can show you how to use the Narcan if you have a family member and you are afraid that they may overdose. We will show family members. We will show the person themselves so they can show, teach their family member what needs to be done, and if they are having overdosing on any of heroin, then we can train them, we can teach them how to use a Narcan kit in order to save lives. Sometimes people may ask, well, if I do that, will I get in any kind of trouble? No, you won't get arrested. You won't go to jail. If you use Narcan to save somebody's life, it's the Good Samaritan law, and you won't be held responsible for if anything happens to a person, if you are in the process of trying to save someone's life. Next slide.
Ms. Lewis, I have a question. Can you explain what the Narcan kit is, or like what is it?
What we administer, and it's free. We give it to individuals and family members free who are persons served at our clinic, and they just could ask the nurse for it. But basically what it is that it's a nasal spray. It comes in a package. It's in a nasal, it's a nasal spray. And once you open it, all you have to do is just, when you see somebody in distress, somebody who is experiencing you know, or you may know, experiencing an overdose, then all you have to do is just take that kit and spray like you would do any kind of nasal spray, and give them 2 squirts in their nostrils, and that should help them recover. Once they recover, then you should call 911. That person needs to go to the hospital. You just can't give them the Narcan or spray within somebody's nostril and just to say, okay, I done did my job and that's it. They need to go to the hospital where they can get further treatment. But it is a nasal spray that we use to help revive someone who is in a drug-induced crisis. Any other questions?
Not at this time.
Okay, next slide. We offer, Metropolitan also offers some group service, support services. We have crisis counselors. They go out into the community. They go to hotels. They may go to other businesses. If anybody is needing somebody to talk to, they're there to provide support, to provide a listening ear. And through the COVID-19, we have done more and more community outreach so that people who are feeling uncomfortable, who are feeling stressed, and they need somebody that they can talk to. You can also, again, that magic number, 568-3130 for any kind of counseling services that you feel you or your family member may be in need of. Next slide. We also do what's called the Get Your Mind Right. It's a virtual chat line, and it's every Friday from 10:15. It starts at 10:15 a.m. and the community is welcome. Family members are welcome to take place in what's called hashtag Get Your Mind Right. The website to access it is Healing the Revolution, and it's at iWest. That's one of our partners. And you can access it and take part in it every Friday at 10:15 a.m. Next slide. Oh, there is no next slide, but we also have a support group. We offer a support group, and that support group is every Wednesdays, and that's at noon. And all you have to do in order to call, you should call 517-5922 and ask for Christina, and she can get you scheduled with the support group that we offer for anybody who is looking for either therapy, group therapy, with other people who are experiencing some mental health issues. If there's any questions, please put it in the chat. I just want you all to know that we will be at the health fair on Saturday at Oliver Bush Park from 12 to 4. We will have a table. If you have any questions, any that you would like to ask us, then you can stop by our table and feel free to ask us whatever questions you may have. Thank you all for inviting us to participate in this forum. And if you have any questions now, I'll be glad to answer those as well.
Ms. Lewis, I do have a question, and I think some people may also have this question, like when they watch this program, like, what are some signs that people should kind of like watch out for when it comes to like recognizing that someone may need help, whether it's drug addiction or just mental health in general? Like, what are some things we should probably look for?
Well, sometimes people will isolate, they will isolate from their family members or from friends. They may not want to do some of the things that they are normally accustomed to doing. They will stop doing some of those things. They may become more, you might see more anger. They may become more angry in their behaviors. They may become more depressed than what the normal, what you are usually used to seeing that person behave. In children, again, they may have more anger outbursts as relates to children, but we all can isolate from individuals or from family members. We all behaviors, we may have changes in our behaviors and stop doing those things that we are accustomed to doing. And when it becomes a long period of time, depending on how long, and this person seems to be, things doesn't seem to be changing within that person, and they're becoming more and more isolated, more and more not doing the things that you are accustomed, then that's the time when you should reach out and try to get some help for that person, whether or not it's with Metropolitan or whether or not it's through any other counseling agency that's out there in the community.
I think I have one more question, and by the way, these are all coming from me. I'm thinking along the lines of like Hurricane Katrina now, and just you know how like around this time of the year things may get really difficult for people, like even though it was 16 years ago, people can be easily triggered by things that they see in the community, or just memories, like finding like a shredded photo or something like that. Like, do you have any advice for someone who may be dealing with that, or just ways that we can help each other as a community, or just, I don't know, Ms. Lewis.
Well,
I know
what we consider, because Hurricane Katrina was a traumatic event for all of us. And so it's it's called post-traumatic stress. And as it get closer to August 29th, many of us may start to experience some anxiety, some panic feelings around that, the memories, some depression, you may become tearful, you find yourself crying, and you can't put a Then as you start to think about it, you know that, okay, it's around this time, and that makes it cousin. But so that's normal, but it is still considered post-traumatic stress, and it doesn't matter how long ago it's. So and some people say, oh, I don't want to talk about it. You
right.
Say, oh, that happened long ago, I don't want to talk about it. But that's how we get through it. We need to talk about it. It's not that we, are trying to say I don't want to think about it. But in order to get through it, we need to talk about it. That helps us. So if you are feeling like that as it comes closer to the 29th, then it's okay. It's okay to reach out to Metropolitan. Again, it's okay to participate in some of our groups that we have by calling the 568-3130, and we can direct you as far as where you can or what you can do in order to get some services around that day. It's a stressful for all of us.
Yeah. And I just noticed that too, like when you were talking about some of the symptoms and just like, being around family members and friends, and like, just kind of like how you notice that little shift in moods and like things that people would normally do, they don't actually do them. They want to stay isolated, and they're they're more aggressive.
Right. Those are the ones that we just need to reach out and say, some people are you okay? Anything bothering, would you want to talk about anything on your mind that you feel that you want to talk about, and just to acknowledge it. That's all it takes for somebody to feel better, or to know that somebody is understanding, or somebody cares about what I'm going through at this point.
Understood. Wow, that's all from me. I'll let my other coworkers ask questions now.
Hi, this is Cynthia. I do have a question, and I want to make sure, maybe I misheard some of it, and that was in terms of going to an individual's house who may need service. How does that work?
Now, when I said go to someone's house, if someone is in crisis, we have a mobile crisis unit. Metropolitan Services in general office space, the general basic services. But we have mobile crisis unit. If someone is in crisis, someone is threatening to hurt themselves, someone who's in severe depression and may need to go to the hospital before we I would say call 911, but if they are threatening to hurt themselves or hurt someone else, then of course 911 would be the number to call. But we have a mobile crisis unit that you can call, and that crisis unit will go out to the home, or they will assess the situation from the phone call and determine whether or not they need to come out and assist the family with getting that individual to the hospital. And that's what we provide, a mobile crisis response team that will go to the house if needed in order to help families deal with a crisis that's going on at the home. But our services are basically office-based, but we do provide the crisis counseling.
Okay, thank you.
Anything else?
Okay, turning Sarah, are you still on?
I am.
Oh, there we go.
Well, thank you, Ms. Sherridell. We really appreciate you coming on. I know that, especially as Gaynell said, during this time of year, we all need reminding of just different ways in order to make sure that we are staying healthy. And obviously mental health is a huge part of that. And so we really appreciate it. As Ms. Sherridell said, but somebody from their office will be at the Community Resource Fair on Saturday from 12 to 4. So if there's something that you missed, or you have some questions, or you just need to talk to somebody or need to refer somebody, that would be the place to come to Oliver Bush Park on Saturday from 12 to 4. Some other events we've already kicked off this week. We had the Linda Jackson Good Neighbor Awards ceremony last night. If you missed that, make sure you go to our website and check that out at l9wha.org. And the link will be posted hopefully sometime by the end of this week, and if not, by next week. We also have tomorrow morning, bright and early at 7 a.m. We've got yoga with Swan River Yoga here in the L9. It is going to be on Deslon, right at the river, up on the levee. Bring your yoga mat, bring your water bottle, come on out. Thursday, we're going to have an L9 homecoming, a conversation with past and present L9 residents at 6 o'clock here on our Facebook page again. That is www.facebook.com/L9WHA. Make sure you share that. That's going to be a great conversation. Saturday, again, we said the resource fair is going to be there. There's going to be so much stuff. I'm trying to remember everything that they're giving out. We've got free nachos, snowballs, hot dogs. We've got school uniforms, vaccines, if you know somebody who needs a vaccine. But there's over 30 different organizations, both local L9 organizations as well as around the city, that will be here talking about hurricane preparedness and a whole bunch of stuff. And then Sunday, we've got 3 different major events going on. We've got 11 a.m. at MLK Elementary. We're going to have a Hurricane Strength and Unity March. It is going to then wind its way back to the high school. The mayor will be there, as well as our state senator and state representative, I believe. 12 o'clock, there is going to be a second line hosted by Sess and Robert Green. That's going to start at the marker down on Jordan and North Johnson. And then at 1:45 is the Hurricane Katrina healing ceremony. And that's going to start at that same location there on Jordan at the marker. If you have any questions, feel free to reach out to us at the website. And again, we really appreciate you, Ms. Sherridell, joining us this evening. Good night, everybody.
Good night.
Night.
Good night.